Newport News Shipbuilding is seeing a rise of COVID-19 cases, especially around outfitting berth 1 or OB1. We're trying to figure out exactly why that is, and we're also working very hard to stop it. Company President Jennifer Boykin sent out important reminders for shipbuilders on June 16th about personal responsibility in helping to prevent the spread of coronavirus. Washing our hands, using hand sanitizer often, minimizing and cleaning common touch points like coffee pots, doorknobs, and file drawers, and wearing our masks properly. The shipyard is deep cleaning and communal eating areas are once again being shut down. But is this enough? Some shipbuilders on Facebook are asking about going back to 3 shifts, returning to liberal leave, or shutting areas down where cases are increasing. Via WebEx, we talked to Dru Branche, Environmental Health, Safety, and Security Director, about this and other concerns shipbuilders have. So Dru, the first question is about OB1, outfitting berth 1. We're seeing an increase in cases around that area. Do we know why?
Well, Bryan, I don't know that you can pinpoint it to a very precise answer. It's a mixture. But what I can tell you is we're seeing clusters of cases within work groups. And those folks share common meeting areas, they share trailers, they share some work assignments, but it's more their before shift, lunchtime, and after shift activities that seem to be what's causing the spread of the virus more than anything else.
So what are we now doing to help at least slow this or stop the spread?
The very first thing we've done is we've been very broad and very conservative in our contact investigations. If we think there's even a remote possibility, we've sent folks home quarantine as a precaution. One of the other things that we're doing is we've had our professional cleaning company come in and do fogging of the trailers that they work in, the restrooms, which goes a little above and beyond what our X33 and our O46 cleaners have been doing. Not saying they're superior, just that it's a different formulary, and we're trying that to see if that's helping. We're encouraging people to use more natural ventilation. Those trailers and work areas, open the doors, open the windows, let some fresh air in. That is very helpful. We're trying to make hand sanitizer and hand washing stations more available.
And yeah, you mentioned like the hand sanitizer and hand washing, and folks need to realize there is nothing wrong with going to your leadership, your supervisor, and saying, hey, you're telling us to do this. I don't have any supplies. You need to help us.
Not only is it okay, I expect you to do that. Hold our management accountable if you are not getting the access to what it is you need to wash your hands or to at least sanitize them.
And so when we're tracing cases, I mean, obviously we're working diligently in the yard to try to do everything we can to mitigate this. But outside of the yard, people are going home. They're happy the state is in phase 2. They're going out to dinner, doing things, socializing. I mean, are we finding that if we trace cases back that we can pinpoint that it actually was from something outside the gates?
A number of our cases have origin outside the gate, and Bryan, we're all tired of quarantine. There's no two ways about it. We're a little stir crazy, and phase 2 opens up more opportunities for us, and I'm all for that. We just have to be very mindful of the things that we do when we're not here and make sure that we're being cautious.
And so, that being said, obviously I'm sure that we can also trace cases that were spread inside the yard as well.
Absolutely. And, there's a whole vein of this virus that doesn't necessarily start with fever. It starts with the loss of taste or smell. That isn't going to be picked up in your temperature screening. Right. And so we have an instance where someone came to work not feeling well, but not with a fever, And they even came to work after they had had their test to inform their boss that they had had a test that morning. That's not helpful to the cause, right? That's a patient zero for us.
Right. So, I'll tell you, you look at Facebook and our social media, and you do see people specifically talking about the 3 to 2 shifts is just not working. The shipyard needs to go back. I mean, what is the answer to that, if there is one right now?
I think that if you go back to February, right, even to March, before liberal leave started, but as COVID was here, we had 80% of our people on first shift. I think that the shifts can be whatever the shifts need to be, as long as you're social distancing and wearing your mask.
And it does help out in that crossover between shifts. There's not so much interaction with people coming and going.
Right. It does give you, I mean, we still see bunching up at the gate. And again, I implore people, if you're staggered in your release, allow the people ahead of you to get out. Because if you're wearing your mask and they're not, they're far more dangerous to you.
Other questions we're seeing are we going to go back to liberal leave? I mean, I know we're probably not there yet, but what are we saying?
I don't know that liberal leave is the answer unless people are willing to go home and stay home.
Yeah, great point. I mean, that's the thing. So when the whole state was on shutdown and we were on liberal leave, I mean, it was really stay home, don't go anywhere. And people, for the most part, it seemed, were heeding that warning. But again, as we open up and people do start socializing and going out to restaurants and things like that, that's where we need to be vigilant.
It's beautiful weather. People want to be outside. People want to see family. They want to do the things that we normally do in the summer. And I get it. I really understand why people are motivated to do this, but you just have to be mindful of the risk that comes along with it at this point.
So if the cases are increasing at OB1, why not just shut the place down for 2 weeks and try to figure out why?
I would tell you, I'm not there yet, for the simple reason that these cases are very concentrated in a couple of locations. And it is, there is ability to distance.
Yeah, and that's a good point, because a lot of people say that there is not ability to distance, but the way that we're working it out, they should be able to do that. And if they're not feeling that they're able to, they should go, again, talk to their leadership.
Now, as shipbuilders, the one thing that we can do to help each other, to help the nation, is to be good citizens, wear our masks, distance as best we can, live a life that isn't stuck inside your house, but is appropriately cautious for the times, and do the right thing for your buddy here at the yard.
Yeah, and your family.
And your family.
And we are working with the Navy and their medical personnel to keep Navy personnel, shipbuilders, and others who enter the gates safe. So please remember the 411 website, our social media pages, and NNS to go for the latest information. Thanks so much. I'm Bryan Moore.